So this is the aggressive posterior ROP. Previously, aggressive posterior ROP was called. Now the newer terminology is aggressive ROP. It is not posterior. The newer term has come up. This is called as an aggressive ROP. Basically, this aggressive ROP, as the name suggests, it is a severe plus disease. So you should know what is a plus disease, isn't it? So plus disease means the retinal vessels are very, very dilated and tortuous. That is a plus disease. Okay, so all the fundus is done, funduscope image will show you very, very dilated and tortuous retinal vessels. That is called as a plus disease. There's one more entity called as a pre-plus disease. Pre-plus disease is the vessels are dilated but not very tortuous. Okay, so it's not very tortuous, sufficient enough to be called as plus disease. So it is a pre-plus disease. So plus and pre-plus has to be differentiated. Aggressive ROP is something which will have plus disease, and more often there is a neovascularization along with fibrosis will be present, and aggressive ROP can also have intravitreal and intraretinal hemorrhages can be present. So this is an aggressive ROP components. This aggressive ROP usually doesn't go from one stage to the other. Usually the neovascularization is quite rapid, that it doesn't progress from stage 1 to stage 5. It progresses very, very quickly. The typical stages it doesn't follow. So, and very, very experienced examiner is needed to identify. Sometimes it is only in the posterior location. So, it can be missed also. Right. So, this is plus, pre-plus disease, aggressive ROP. All of you are clear with this? So, you should know what are the zones, ROP zones. What are the stages of ROP? What is plus disease? What is pre-plus disease? And what is aggressive ROP? Right. So, this is something which is very basic. We need pediatricians have to know. Right. And this is again regression and reactivation. So, regression is, we know that this ridge is getting regressed, and here you cannot appreciate. There is no ridge here. It looks fine. And now again there is reactivation. Again the ridge is forming. So, the regression and reactivation can happen. See, there is newborns born extremely preterm. They keep coming back to the hospital for repeated admission, say because of apnea of prematurity or because of sepsis or some congenital cardiac lesions. So they have a very, very on and off course inside the hospital. So these newborns can have this regression and reactivation. So one needs to be aware of this also. So what happens once you do not treat ROP? What can happen? What are the long-term sequelae? So the long-term sequelae is one that we have seen already, that is stage 5, complete retinal detachment. Because of involvement of the optic nerve, there can be macular anomalies. There can be vascular changes, that is retinal hemorrhages, retinal vascular changes can be there. Retinoschisis can be there. And permanent or persistent avascular retina. The whole retina can be devoid of blood vessels. And glaucoma. Glaucoma because of the extra, or because of the increased VEGF factor production, there can be glaucoma also. So, long-term sequelae of an untreated ROP can be all these. So, remember starting from retinal detachment, macular anomalies, the avascular retina, retinoschisis, and glaucoma, right? So, these 5 long-term sequelae you can remember. So, these 2 beautiful images are from our IAP standard treatment guidelines, retinopathy of prematurity. So, you can see there are many images like this, but very, very simplified images I have seen. So, I have put these.